Let's go to some more fun bonus longevity habits to learn about. Sauna bathing. This is a study I picked out of many, dozens from 2018. Sauna bathing is associated with reduced cardiovascular mortality and improves risk prediction in men and women, a prospective study. The higher frequency and duration of sauna bathing are each strongly, inversely, and independently associated with fatal cardiovascular disease events in middle-aged, elderly, male and females. The frequency of sauna bathing improves the prediction of the long-term risk for cardiovascular disease mortality, heart attack, strokes, bypass, stents. So the more you use the sauna, the more frequent you use the sauna, the longer you use the sauna, the lower is your risk of death. This is a very large prospective study in Finland. Finland is doing most of this study. So if you look over to the left, that's the frequency during the week of using a sauna you have access to. In Finland, most people have a sauna in their backyard or associated with their home. The blue line is using the sauna once a week. The green line is more than 4 times a week. And the measure is your risk of cardiovascular mortality. And you can lower your risk of dying of heart disease, at least associated, by the habit of using your sauna 4 or more times a week. If you look to the right, that's how many minutes you spend in the sauna a week, a different way to measure it. The blue line is less than 15 minutes a week in the sauna. The green line is more than 45 minutes a week in the sauna. And in 16 years of follow-up, the risk of dying of a heart-related condition goes down dramatically with the amount of time you spend in your sauna. And this is, again, from an ongoing large prospective research project in Finland, where this is part of their culture. They do adjust for many factors like diabetes, smoking, high blood pressure, body weight, age, blood pressure, diet. So they tease out independently what sauna can do. Infrared sauna has a wealth of data from Japan. I have in my home a full spectrum infrared sauna, near, mid, and far, and I use it regularly. Steam and dry sauna all have data more from Finland. I mentioned already the term for a minute that not everybody's familiar with, hyperbaric oxygen therapy, HBOT, the administration of a higher pressure and a higher concentration of oxygen than room air. This happens to be a very large hyperbaric oxygen chamber outside of Tel Aviv, Israel. There's similar chambers like this now in the villages north of Orlando in Florida, and also now in Dubai. They opened because the Israelis have a company called Aviv Medical, A-V-I-V, like Tel Aviv. Aviv means spring, maybe youthful. And what they've shown, and I won't go through all the data, but you can actually document, for example, MRI brain blood flow, that pre and post hyperbaric oxygen therapy, there's a dramatic increase in brain blood flow by various protocols. They developed outside of Tel Aviv, a researcher that I'm acquainted with, Shai Efrati, MD, a nephrologist, but his research now is all on aging and hyperbaric oxygen therapy and post-traumatic stress disorder and hyperbaric oxygen therapy and stroke and recovery and hyperbaric oxygen therapy. But a lot of it's on anti-aging. They've discovered that while people are sitting in the hyperbaric oxygen chamber, they alternate between 100% oxygen and room air, 100% oxygen and room air. And that alternating administration of high oxygen, they believe, stimulates more anti-aging factors than the protocols that are used in people who've had a scuba diving accident or have wound therapy, where they don't usually do that. So if you look over, this is work from Dr. Shai Efrati. Hyperbaric oxygen therapy is a new treatment approach for Alzheimer's disease. You can look in the middle under neurons. PO2 is oxygen levels. And they believe by going up and down, hyperoxia, that means a lot of oxygen, hypoxia, low oxygen. It's the alternating that stimulates the growth of a variety of factors or release of a variety of factors. that can stimulate return of function in brain cells and maybe new brain cells. Fascinating. And there probably is a center in your town that offers hyperbaric oxygen therapy. There are thin-walled chambers that can't achieve high pressure, and there are thick-walled metal chambers, like the one I showed you a picture of, that they can get to at least 2 atmospheres to make this comparable to what they're doing with the Israeli research group.